child makes a back and forth, one kind of conversation with their parents, with the eye contact, the social smile, as early as 4 months. The child can respond to his name by 6 months. He brings a toy and shares a joy with them. Look, mama, see, come, a book or whatever. That's called a shared joy, which comes around 9 months. The child can point at things which he wants or shows gesture by about a year. And the child follows a very simple command by 1 year. And also by 18 months, it says one meaningful word at least. So if any of these signs are absent and you find the child is not doing any of this yet, you should be highly suspicious if there is my child being the autism spectrum disorder and should talk to your physician to really rule out this condition.
Denial, anger, doc is saying rubbish, different doctors are consulted. Then comes the grief and then comes the what is called acceptance. And when you accept, things become better and things start. Therapy actually unfortunately starts when they accept. So I think it's not all bad. Do it early. If you do it intensively, many of them become very normal.
We need to understand what is autism. That is, it is a social communication disorder and there is a restricted repetitive behavior. So there will be less eye-to-eye contact, then speech delay will be there. There will be maybe a comorbidity like hyperactivity. So we need to identify it early and treat early. So early intervention plays a major role along with that medication also and the nutritional supplement. So ASD, if diagnosed early, started with the therapies, early intervention and medication will give very, very good result in an early period of life. Thank you.
So awareness of autism is very important because diagnosis of autism, if you diagnose early, the outcome is very good. So all parents and also pediatricians should be aware that recognition is very important. Most common symptoms are lack of interaction and language delay. It should not be postponed as most of the parents think that children will speak slowly, but it should not be thought like that. You should be seen other milestones also along with long way with the interactions of the children should be normal. If there is delay in interaction, then you should consider this is one of the features of autism.
As you know, autism incidence and prevalence is increasing worldwide. One of the major contributors for increasing incidence of autism in children is exposure to media, including television, mobile, YouTube, and other videos. American Academy of Pediatrics recommends 0 screen time for infants less than 2 years of age.
I would like to give a special message regarding types of autism: primary autism and secondary autism. Primary autism means it's multiple etiologies, it is multifactorial, and with the good hard work, these children can improve a lot. And of all the autisms, more than 85 to 90% children are with primary autism. So good thing is, they don't need many investigations. With the good teamwork, they can achieve healthy lifestyle, healthy milestones, and can self-sufficient independent life. And the next step, the chances of recurrence is only 5%. Where secondary autism, which is hardly 10 to 15%, those children have learning difficulties, issues with the lifestyle, lots of other comorbidities like epilepsy and so many other issues, behavior issues, learning issues. They need thorough investigations and they need lots of hard work and continued support throughout the life.
So when you do a diagnosis of autism, we tend to take the diagnostic criteria by applying the DSM-5 classification, by which the DSM-5 classification, the autism is called as disease number 299.00. It has two major components. One is core symptoms, second is accessory symptoms. Core symptoms are labeled as A, accessory symptoms are labeled as B. Apart from that, there are C, D, E. There are three main criteria which will make us think about the diagnosis of autism. It's very important to notice that the core symptoms are negative symptoms, while accessory symptoms are positive symptoms. Core symptoms are not seen, it needs to be pursued by the parents, while B group symptoms or accessory symptoms are obviously seen and noted by the parents.
April 2nd is the Autism Awareness Day. Autism a social communication disorder can be considered as a result of the fracture of the social fabric these days. I think that autism is due to the poor socialization because of the micro-nuclear family, where the parents put their babies to YouTube for their own career purpose. This leads to the very clinical manifestations of autism, that is poor communication, poor socialization and ritualistic behavior.
Everyone, autism is one of the complex developmental disorder in children, so where there is a abnormality in the social interaction, or there may be a speech or language delay, there may be non-verbal communication problem, or there may be a restricted or repetitive behavior. And the severity varies from child to child, but it is worldwide accepted that if this intervention is done earlier, the outcome will be the best. So it's my request to all, if there is any delay in speech or language or this introvert child, don't think my child is shy or introvert and wait for the normal development, or there is any speech delay or lack of communication, or there is no interactive play with the other children, please consult doctor for the proper diagnosis. Thank you all.
Autism is a very unique and intriguing problem. The word autism comes from the word auto, meaning self. And as you can see, these children are very self-driven and they are very interest-driven, and they are not like other children, normal children. So this could be very bewildering to the parent. But if you look from the child's perspective, they need to be understood from their own level and from their own terms. And gradually, we need to mold them into this neurotypical world. So the way forward is that in the whole management, try to give them a very good subjective well-being.
Most of the parents knew the word autism, even the new parents knew the word autism. There's a lot of information available, but that also led to a lot of confusion and denial in some parents. Most of the parents were worried about labeling the child, diagnosing the child. However, I think take it in a positive spirit that this is a way to helping your child communicate with the world. With the right therapy, the child can really improve. One universal tip which I want to give to the parents is that you can cut down on screen, talk to your parents, talk to your children, interact with them, and you can do wonders yourself. Thank you and stay safe.
Today on World Autism Day, let us all together join together to recognize these individuals as fellow human beings without discrimination. Let us respect their individuality and change our attitudes towards them and not be biased against them. Thank you.
Neurodevelopmental disorders basically are disorders which emerge in the developmental period of a child, and they are basically associated with specific areas of the brain developing at a slower rate as compared to the others. Now, this is important to keep in mind because once we identify certain forms of deficits, for example, speech delays or lack of speech or loss of speech at any developmental period, lack of social development, which would be appropriate to age, it is important for us to identify this and start addressing this as early as possible. The problems associated with autism spectrum disorders can be addressed through early intervention, which would require us to identify them early and manage them early. Thank you.
Dear parents, if your child doesn't produce meaningful word by 16 to 18 months, doesn't respond to name call or make eye contact, lines up toys, or do not play with other children, or do not do the make-believe play, please screen for autism. If your child is old enough, then having difficulty in starting a conversation or making new friends, or if they are uncomfortable in social settings like in marriage functions, then he should be screened for autism.
Today is 2nd April, which is celebrated as the World Autism Day. As we know, more and more cases are diagnosed with autism. But still in our society, these children with autism are discriminated. So on this day, as a pediatric neurologist, I want to appeal you, let's come together, accept these children, support them and empower their needs. Thank you.
Today on World Autism Day, it is a request with the way the incidence of autism is increasing to everyone to please take it seriously. So if the child is showing any delay in social communication, in the play skills, in interpersonal, in imitations, in interaction with the parents, please at least ask your pediatrician or any point of contact you are having. There is something needs to be done.
There's a saying that goes like this: stitch in time saves 9. Autism is not the end of the road, it is just a bend. Early identification and intervention in autism is very crucial. Wish you all a very happy Autism Day, my dear parents and children. Thank you.
World statistics says 1 in 59 children have symptoms of autism. Indian statistics says 1 in 125 children have symptoms of autism. It is a problem of neurodevelopment. Kids will have various symptoms, so it is called as autism spectrum disorder. The problem may be in the language communication. The child may have a language, but he did not use it to properly communicate with the parent. The second issue is in the social interaction. The child will tend to play alone. The child will not give a good eye contact, which is the first symbol of social interaction.
Autism, as many think, it is not a mental disorder, it is a neurodevelopmental disorder, mainly delay in the social and communication domain. If we identify and intervene early, we can bring the best from the children. Like any other children, these children also have their own passion, desires and goals. Many do well in the areas of business, engineering, health promotions and many more. These individuals will be hardworking, sincere and trustworthy individuals.
Autism is a neurological developmental disorder identified from early childhood. Children with autism have challenges in socialization, communication and behavior. They need better understanding not only from the parents, doctors, teachers but also from the society. Early identification of autism and early intervention will bring better outcome. Whenever you take your child to a pediatrician, it is important for you to know whether the child's milestones are achieved at the appropriate age.
So being a pediatric neurologist, I want to emphasize the role of a pediatric neurologist with regards to autism spectrum disorder. Our role is to diagnose early, guide and help the families of children with autism for early intervention programs, and also identify if there are any comorbidities and treat the comorbidities if any. And I request all the stakeholders who are involved in the care of children with autism spectrum disorder, namely behavioral pediatricians, developmental pediatricians, child psychiatrists and child psychologists, to work with pediatric neurologists to improve the quality of life of the children as well as the families.
April 2nd is World Autism Day. Autism is a neurodevelopmental disability where the child has a problem in speech, communication and socialization. Parents will suspect the problem during the first 2 to 3 years. Early diagnosis and intervention gives an excellent outcome. A child with autism has to be managed by a team of experts, medical experts, therapy experts and caregivers to correct the core problems and to change the stereotypic repetitive behaviors. Autistic child will have hidden talents, identify and appreciate it.
Let me start by saying that children on autism spectrum are very close to my heart. They are not just special, they are exceptional. What we often fail to understand is that we have so much to learn from individuals on the autism spectrum. Children and adults on autism spectrum are loyal, sincere, straightforward, and they have such attention to detail that can be made use of in many professions.
April 2nd is World Autism Day.
Autism is a disorder of language and communication in which children do demonstrate certain behavioral problems, including repetitive behaviors, aggression, agitation, etc. It's very important to identify children with autism at the youngest possible age and train them appropriately so that they can be mainstreamed. So look for any signs or symptoms of language delay and developmental delay in your children. Get professional help and train them appropriately so that they can be gainfully employed in future. Thank you.
World Autism Day, I want to say that early recognition and early intervention is very important. Pediatrician must educate the service provider as well as family about the autism fully. And my request to parents, they must trust on their service provider as well as pediatrician. Thank you.
Autism is a neurodevelopmental disorder basically characterized by two features with low and poor social interaction, and the second one is the repetitive and restricted behaviors observed in the children. It can be like toe walking or more interested in the wheels or like the swinging behavior. So the treatment for autism is only through behavioral approach, that is through ABA or occupational therapy or sensory integration. So the earlier we start the treatment, better is the prognosis.
There are no biomarkers which can directly diagnose autism, but there is assessment by questionnaires. There are many questionnaires. We can assess the autism and also grade the severity of autism into mild, moderate, severe. So after the assessment process, we start medical treatment and also rehabilitation, which includes occupational therapy, speech therapy, special education. Fine. Thank you.
We all know early identification of autism spectrum can help us in getting an early diagnosis, and it can also help us provide intervention to children who get identified early in their lifespan. And it has been well proven in science that early intervention has better developmental outcomes, better long-term developmental outcomes. Hence, it's very important for us to know the red flags of autism spectrum disorder.
A word about autistic children. We need to understand them and integrate them into our society. The pediatric neurologist and the developmental pediatrician should be the focal people who work together to evaluate these children and guide them to various therapies. And these multiple therapies allow them to get educated and integrated into our society. The real recognition of a very progressive society is when the children with differently abled features, such as autistic children, are integrated very well into the society to be educated, to get jobs and employment in a very good way and integrate into our society.
2nd April is World Autism Awareness Day. Every child with autism is unique in his capacities. Each child of autism may not learn the way we learn in our life. The child with autism has his unique learning style. If we identify the learning style of the child with autism and teach him accordingly and with a lot of patience, I am very sure the child will be able to learn it effectively and move ahead on the course of life. Thank you.
On this World Autism Day, if I were to answer a simple question, what is that single step which is going to make a difference in the life of a child with autism is that therapists and parents must do those things which are going to make the child smile more often. It may look very simple, but this single thing will make your child more happier, will form a strong bond between you and your child, and will definitely go a long way in improving his behavior and learning skills.
1 to 2 years is a very important time in a child's life. They tend to learn all the social behavior and social nuances during this period from their family. If they are unduly exposed to mobile phones during this period, then they go into a one-way communication which predisposes them to autistic spectrum features. This is to be avoided at all costs to prevent the pain in later life. Thank you.
So autistic children are very special children and they are little different from the normal children. So autism per se, it's not a disability. The children are very unique in their way. They have a different abilities to do that in their life. Sometimes we feel they are very mysterious, very unique, very different from the other children. But it is not an intellectual disabled children. This type of children requires little extra care, support from the doctors, from the families, from the parents, friends, and the society.
That autism is a neurodevelopmental disability in which their brain develop differently, so they have different thinking, they have different perception of the world surrounding them. They are not a disease, it is a lifelong condition. They are just different than us. They need care, support from all of us. We can all make difference to their life by just talking to them patiently, allowing them to join us by making some adjustment. Don't force them to be like us or fit into our thinking. Just let them their self. Thank you.
Friends, we all know the autism is on the rise all over the world, more so in India. And we are finding many cases every day. Good number of children are getting such types of syndromes. The scientists are working overtime and they are developing newer and newer molecules. Cognicare is one such molecule. It is available in the syrup and tablet form and it works very nice in the autistic children. To my experience, we have used in many patients. Thank you.
In the management of any disease or condition, early detection of the disease is very important. This is especially important in case of ASD. Red flag signs will be present before that. This is very important. Don't wait for the diagnosis to put in, but if there is any red flag signs, you start the intervention immediately. That is the most important message I have to give during this time.
Autism is not only highly treatable, autism actually can be detected pretty early in life. There is an assessment tool which is internationally validated and standardized, which is known as General Movement Assessment or Prevalence Assessment from Graz University, Austria. This is a worldwide used tool now where we can detect risk of autism with quite a bit of certainty by 3 months of age. At 3 months of age, there is no other tool that can detect autism at any rate. But general movement assessment can. The sooner we can detect, the sooner we can institute early intervention, and effective early intervention can normalize a child with autism.
On this World Autism Day, let us all pledge together to help and understand children with autism. Autistic children have difficulty in communicating with us both verbally and non-verbally, and also have sensory processing issues. These can be only dealt if we understand them and if we start early therapy to them. So let us all take a small step towards them, which will make huge difference in their lives. This will help them to grow like any other child which they deserve to be. Thank you.
Teamwork is the key word in treatment planning. Behavior therapy, psychosocial intervention, and sometimes pharmacotherapy may help the children. Prognosis. Some of the disabilities may continue into adolescence and adulthood. Comprehensive treatment may minimize later disabilities. The research is still on. We know we are getting new informations from different angles about this illness every day.
Good day to everyone. On the occasion of this Autism Day, I want to spread a message regarding autistic children to the parents, that all the parents must involve in spending a very good quality time with their children by improving their verbalizing skills, and social interactive ability would be improved, and the children are to be avoided with the gadget usage also, and they must be included with the play therapies. Thank you.
I would like to tell all the parents of children with autism not to feel disheartened and just keep going with regular therapies and the suggestions which you get from the doctors, and your children have a bright future ahead. And also to the community to understand that autism is not an abnormality. These children are not abnormal. Autistic children are just different, and we as a community need to understand this difference and deal with them. Thank you very much.
Autism is a unique wonder of development. If your child is at high risk of developing autism or suffering from autism, it doesn't mean it's an end of the world. Try to seek the expert opinion and start early intervention and therapy. Earlier the diagnosis, intervention and therapy is much better as the prognosis. Your child has certain tests, behaviors and ways of doing different things. Try to understand them, have an empathetic approach, and finally empower yourself for this unique wonder of the development. Thank you very much.
On this World Autism Day, let us all stand united to fight against autism. Let all the parents know the red flag signs of autism. Let us identify it as early so that early intervention can be started. Thank you.
Autism is a curable disorder, and these children need to integrate in a society as normal kids. They need special attention, special education, special care. So we should come forward together and help these children to beat autism. Thank you.
If you have met one child with autism, you have met one child with autism. That's how unique autism is. Each child presenting with autism presents in a different way. Each has their own strengths and their own weaknesses. Early detection, early diagnosis, and early intervention goes a long way in treating children with autism. On World Autism Awareness Day, let's try to make sure that these kids with autism get the correct help and can be reintegrated into society and do their best.
What is autism? The children with autism usually have deficit in reciprocal social communication. They prefer solitary and stereotypic play. So if ignored, this problem continue to persist throughout life, and which leads finally to significant dysfunction and disabilities. But with proper attention and support, if we intervene properly, the children can do very well and perform very nicely in all the domains of life.
I want to highlight some important points. What are the points you know? First, one important point is poor eye contact. Poor eye contact mind. 2. Preferring to stay alone and does not play with the peers. Does not respond to name at the age of 1 year of child. No single word by 18 months of child. Inattention, hyperactivity, impulsive and repeated behavior. But not least when a normal behavior is not displayed by the child. Thanks, and these are the.
On behalf of Autism Day, that is 2nd April, I would like to tell all the other parents that we should be very accepting such kids and help those parents and children to understand the psychology behind autism spectrum disorder. if we understand as a society, then more early diagnosis can be made, or more open the parents will be to tell the problems in these kids, and early we do the interventions, the more good results are.
Autism is a neurodevelopmental disorder which has deficits in age-appropriate social communication and emotional reciprocity. They also have repeated ritualistic behaviors which can be motor stereotypes and vocal stereotypes. As autism is a spectrum, child with different age groups will present with different complaints. It can be suspected as early as 3 to 9 months, can be diagnosed by 2 years of age by using different tools. Early identification and early treatment will help the child for the betterment and smooth transition into adulthood. So on this Autism Awareness Day, let's pledge for the better society for kids with autism. Thank you.
Now I'm going to speak for the parents. Parents do go through a lot of challenge, and in bringing up, looking after the children, they are confused, they are upset, they are disturbed, they are anxious, they are worried about their children's future and all. So we as treating physicians should be more compassionate to the parents and extend all the support whatever we can, and try to enroll them in a support group so that they all come together and support each other, and that is how they will be able to cope up with their children in a much more better manner and give their best to their children. For everybody, their child is precious and special, and they also need to be attended in a special manner. This is the appeal for everybody.
The parents should be very knowledgeable regarding this disorder, and when during the normal visits, the pediatrician must inquire about these problems in the children, and a pediatrician should observe the children for these problems, and if we intervene at early age, the child will be a normal one. This is the message I want to give to all on the occasion of World Autism Day. Thank you.
Pharmacotherapy in the management of autism spectrum disorders. The main core features of autism spectrum disorders are social and communication deficit along with restricted repetitive behavior. Along with these core symptoms, there are associated behavioral disturbances in the form of mood swings, irritability, aggressiveness, and seizures. The pharmacotherapy is useful in the management of these associated comorbidities, and they don't have any role in the core symptoms of autism spectrum disorders. FDA approved 2 antipsychotics for the management of these associated comorbidities, and these are risperidone and aripiprazole. Along with this, if there are associated comorbidity in the form of ADHD, we can use methylphenidate and athomzentine. These drugs have complex side effect profile in the form of metabolic disturbances and weight gain. So we have to start in the low dose and titrate slowly.
Autism is a disorder of communication. We speak with lots of facial expression and with gestures. Autistic kids lack this. It's not same that of mental retardation, and proper and timely therapy like occupational therapy or speech therapy will make a significant difference in these kids. So remember, though this is long way, it's proved way. Thank you.
Autism is not a disease, it's a challenge. Of course, it's not a parenting fail, but yes, parenting your child would be more intense, would require a lot of patience and time. What you would need is the right fuel, right environment, and the right support. With those, children with autism who have a lot of potential would be happy and lead a more fulfilling life. And the most important thing, please do not discriminate autistic children with any other child. Thank you.
I just want to tell one thing, that autism is not a disease. It is just the brains which work in different way. So let us do our best to help the children and adults with autism achieve their maximum potential and as much inclusion in the society as much we can. Thank you.
Generally, autism symptoms are seen before 3 years of age, but sometimes children with autism, they develop normally up to 1.5 years and 2 years, then they start losing the skills. This phenomena is called developmental regression. Therapy is medicine for children with ASD. On this World Autism Awareness Day, theme for this year is transition to adulthood. That means there is a great need to think about what services we can develop for kids with ASD when they reach adolescence or adulthood. So on this World Autism Day, let's all join together to increase our care, support and improve the lives of ASD individuals irrespective of their age. Thank you.